name is Margo Franz, and I'm a first-generation Filipina-American and registered nurse. I work as a public health nurse leading the Abortion Access Project at the Washington State Department of Health, a role and program I established in response to the Dobbs versus Jackson Supreme Court case overturning the federal right to an abortion in the United States. In the 2 years since this landmark case, which left each individual state to decide whether or not to protect the right to abortion, I have developed the state of Washington's strategic plan to address abortion access, and I manage $15 million of public funding to increase equitable and affordable access to quality services for all patients seeking abortion care in Washington. I also serve as the youngest ever board president for Pro-Choice Washington, the leading grassroots advocacy organization for reproductive freedom in the Pacific Northwest of the U.S. This year, the National Family Planning and Reproductive Health Association presented me with their Rising Star Award at their national conference. This award is given to an early career professional who demonstrates exceptional leadership and innovation in the national sexual and reproductive health field. While there is an overwhelming trend internationally towards the liberalization of abortion laws, the United States is one of only 4 countries that have rolled back the legality of abortion, and the United States is one of only 2 countries where abortion laws vary significantly from state to state. While 60% of women of reproductive age worldwide live where abortion is broadly legal, the United States controls an inordinate amount of global family planning funding, which carries with it abortion restrictions via the Helms Amendment and the Mexico City policy, which could be reinstated if the office of the president returns to a Republican in this year's federal elections. By the International Conference on Family Planning in 2025, the United States will have its next president, and Washington's Abortion Access Project will be in its 3rd year of funding. We will have collected our preliminary data, which will show the impact of funding and program activities in the era following the loss of national abortion rights. The challenges and successes of Washington's Abortion Access Project can offer valuable lessons for the global sexual and reproductive health community. Because we are functioning under a hostile national political environment, we must continuously innovate and maneuver an ever-changing service delivery landscape. Although some of our obstacles may be specific to the U.S. policy landscape, there are parallels and synergies between our work and the work of those that receive U.S. family planning funding, who must continuously navigate changing regulations while striving to offer comprehensive SRH services. My hope is to present Washington State's strategies for expanding equitable access to abortion as a case study for conference attendees. The Abortion Access Project, which is the first of its kind in our state and one of the first publicly funded population health initiatives to expand abortion access in the United States, can offer practical approaches guided by data to improve access to abortion and promote it to the public as an essential healthcare service.